Okay, this video we're going to go into the internal menus on the LTV 1200. If you notice, we have the menus going here. It is now scrolling, but there are internal things that you need to check and do in order to make sure your patient is running correctly and best on this ventilator. What you're going to do is press and hold select. Now, it gives you a menu. You can go into your alarm operations, vent operations, queries, spontaneous breathing trial operations. I'll be honest, I've never used that. Typically we just dial it. We don't let the ventilator do it. Transducer 0, RT transducer data, event trace. This is where you can go in and take a look at all your histories, your alarms, and exit. So let's start off with alarm operations. When you go into alarm ops, that opens another menu. So alarm volume, so that we'll scroll through, and here's the different menu. Remember, when you want to go into a menu, into that selection, you select it. Apnea is 20 seconds. If you wanted to change it, here, and you hit select. I'm going to dial it back to 20, and select. Apnea apnea time. High pressure delay. There's no delay. I love this one. You can do a 1 breath delay or 2 breath delay. I prefer a 2 breath delay. What this means is the patient will have to high pressure 3 breaths in a row before it audibly alarms. You'll still get a flasher, but before it audibly alarms, you're going to have to high pressure 3 breaths in a row. This is excellent for patients that cough. So I'm going to select that. Whenever you turn the ventilator off, it defaults back to no delay. Low pressure alarm. You want to low pressure all breaths or only the mandatory breaths. I just leave it at all breaths. High frequency. 40 breaths. How did it get to that? Also, if you need to back out 1 step, control lock will back you out. So high frequency. I hit it, frequency, and there's another menu underneath high frequency. It's 40 breaths per minute. Do I like that? Let's change it to 41. Accept. Now time. What time? So this one, once they hit 41, it does not automatically alarm. What it does is they have to breathe 41 breaths per minute for at least 30 seconds. And then it will alarm. If you don't like 30, turn it down. And we're done. And then you exit. Next menu, high PEEP. PEEP plus 5. Had to explain this to a few therapists. This is a math formula. I know how much y'all love math, but this is a math formula. What is your PEEP reading? And add 5. PEEP plus 4. PEEP plus 3. So this would be alarming if your auto PEEP or if your PEEP hit 3. Low PEEP, same thing. 0 minus 3. The patient would have to go down to -3. But since typically we have about 5, you're going to set up the formula. If the patient had a 5 of PEEP and this formula was in, when they hit 2, which is very good for detecting leaks, then it would alarm. Patient assist, normal. Pulse, exit. We always left it at normal. And exit. I'm done with alarm ops. Let's go to vent ops. Rise time. The rise time has to do with the profiles. The profiles are very good in pressure ventilation. They are good. They are operated in pressure breaths only. So one thing to remember, the higher the profile, the smaller the patient. So as you go up to profile 9, these are for your infants. Profile 1, this is for your adults, your adults. This is sort of somewhere in the middle. Most people never change the profile. But if you need to and need to get into it, this is what it is. Profile 4 is about the middle, so if someone's not doing well, take them up to profile 1 if they're an adult. A child, increase the profile, which means the smaller the child. Flow termination. Y'all know what this is. 20% of peak, 30 We can go all the way up and down. Max for this is 40. Time termination, 2 seconds. So if the breath keeps going, which could be with a leak, the breath will terminate after 2 seconds. Pressure control flow termination, off, on. So all those profiles and everything that we did and all the breath terminations, the 2 seconds percentage, is it on or off? Right now I can turn it on, or right now it's off. Leak compensation is on. If there is a small leak in the system, the turbine will kick up the flow. Right now you have 6 liters per minute going through the circuit at all times. If that is not enough, if you start having a small leak, the ventilator will kick up the turbine to compensate for that leak. I've only had to turn this off one time, and that was because we were using this on a child that was actually too small for this ventilator. O2 conservation off or on. What this means is if you turn off the O2 conservation, it turns off the continuous flow through the circuit. The only time that you need to really do that is if you're limited on oxygen, long transport, running tanks, and there's a risk that you'd really run out, and you want to turn on the conservation on. Otherwise, coming out of the walls, we have plenty of oxygen. O2 flush is a 3-minute flush. That's way too long. This is when you hit the O2 flush for suctioning, and I'll show you how to do that. Control unlock, easy or hard. If you hard, you have to press and hold control lock for it to unlock. Easy, you just hit it and it unlocks. Home care, they may use this a lot to keep children, siblings, from messing with the buttons. Language, do not do it. I know some of you have multiple languages. Do not do it. Version, usage, COM settings, set date, set time, date format, PIP. There we go. Queries, and we never went into any of these. So I want to step out, and I'm out of the menu right there. That's going to take some playing. Please play with this. Play with it. Now I told you it's going to alarm. So what I want to do is hit alarm silence. I'm going to have a flasher up here because I don't have any oxygen hooked up. But to do an O2 suction, you press and hold. Whoop, wrong one. I am doing this up here. Upside down. You press and hold the O2. See how it turned to 100%? That means that O2 flush, it'll give me 2 minutes of 100% oxygen for when I suction the patient. You want to alarm silence when you suction anyway, so I've suctioned. This is only reading because I am not hooked up to any oxygen. You can wait for 2 minutes and it'll turn off, or press it and it turns off. Those are the menu settings. That's how to get into the internal menu on the LTV 1200. If you have any questions, I would highly suggest you ask.